The purpose of physical therapy is to create an environment of healing.
The beauty of having physical therapy as part of the practice and so easily accessible is that there can be tremendous collaboration between the physician and the physical therapist. I will often speak with the physical therapist directly or give them very specific instructions about what I have found in my examination of the patient. On the other side, the physical therapist will often speak with me about additional modalities that they would like to add. They will speak with me about questions about the diagnosis. That type of collaboration, that type of interaction becomes very difficult in situations with an outside physical therapist.
This clinic does help a lot in that we're not trying to rush a lot of patients in and a lot of patients out, and we focus on the education, which takes one-on-one time. So we spend a lot more time getting to know our patients and teaching them what they need to do. And I think that's why a lot of times patients will come here who haven't had success in another clinic and see success.
Acute injuries are injuries that come on suddenly, and oftentimes the patients will, maybe fall, they break a bone, they get surgery, and then they'll have to have rehab for that. Or chronic diseases, this is something that could be long-term, it's been going on for a while, sometimes the patients don't even know they have it.
We treat a lot of diagnoses and symptoms. We treat osteoarthritis, we treat rheumatoid arthritis, we treat ankylosing spondylitis, osteoporosis, stenosis. We treat fibromyalgia. We can treat hypermobility, which is an increase in the joint mobility, and there are different levels to hypermobility. We treat general sprains and strains that someone can get from lifting something up at home, doing their daily activities, or from a sports injury. And we treat post-surgical patients.
Some of the modalities that may be used in addressing inflammation in the acute or chronic phase, from manual treatment techniques to dry needling, that may include electrical stimulation, heat and cold thermal modalities.
Paraffin can be used if there's pain. It's hot wax around the designated joint. Typically it's on the hands or the foot. Ultrasound is another modality that can be utilized in physical therapy. It's to increase the mobility of the tissue and extensibility of the joint to improve again mobility and health.
But we also do place a great emphasis on addressing conditions with a manual treatment approach, where we're actually putting our hands on patients to mobilize joints, reduce any kind of soft tissue restrictions with soft tissue mobilization techniques, trigger point release, various grades of joint mobilization to improve mobility.
When you have a chronic disease, sometimes it cannot be cured, but you can definitely educate a patient on how to manage their symptoms, live with it in the best way possible.